Hi, this is Phil Newman from Longevity.Technology, and I'm delighted to say that I'm joined today by Dr. Gary Arendash, who's a principal of RF Longevity and also the research professor at the University of South Florida. Hi, Gary.
Hello, Phil.
Well, Gary, it's great to have you here today because obviously your technology is a wearable, and I'd like to talk about that in a short while. But transcranial radiofrequency treatment is obviously something probably very new to our audience. So why do you believe yourself as a research professional that this is one of the most promising interventions into human lifespan?
Great question, Phil. TRFT is what we call transcranial radiofrequency wave treatment, provides electromagnetic waves in the radiofrequency range to the entire human brain through a first of its kind bioengineered device called the MemorEM. It has 8 radiofrequency emitters embedded in a head cap, and during the 1 hour treatments that can be given daily or not, they are done in home. There's no pain. It's a silent sort of procedure. And most importantly, it's very safe, the radio frequency rays that we're using. And it allows near full mobility. So really during treatment, you hardly know that it's on. As far as why TRFT is a front runner in my mind among gerotherapeutics to extend human lifespan, a number of reasons for that. TRFT was the first gerotherapeutic to be given breakthrough device designation by FDA against a major disease of aging. Second, TRFT stops and reverses a major disease of aging, namely Alzheimer's disease, albeit in small clinical trials.
Yep.
Third, TRFT hasn't shown any deleterious side effects in clinical trials. It's actually been given non-significant risk designation in the United States. And very importantly, with regards to longevity, in our Alzheimer's subjects, and I am an Alzheimer's researcher, TRFT given over an extended 2.5-year period of time resulted in no new diseases of aging. And these folks averaged 70 years of age when they began the study. Finally, you might say that in our 4 clinical publications, we've identified 3 major mechanisms of action that we believe will collectively target diseases of aging, a number of them, and the aging process itself. I could indicate those 3 mechanisms briefly if you'd like.
Yeah, I mean, Gary, I think the MOA is very important because, of course, a lot of people are going to be comparing what you're talking about, which is a wearable device, right? A cap that you put on, and you've got a pack that you wear on your clip on your belt or whatever it may be, which is obviously very different to what so many people are working on in the therapeutic space, where their timelines are 10 years, 15 years. And of course, we've seen what's happened to some of the therapeutics that have been deployed into the Alzheimer's space and the market reactions to those. So yeah, it'd be really good to understand the MOA.
Sure. Most neurodegenerative diseases, Phil, such as Alzheimer's, Parkinson's, are caused by brain toxins that self-aggregate. And the 2 primary toxins are A-beta, beta amyloid, and tau. Now, both of these molecules are made inside neurons, and in their singular form, they're innocuous. But as you age, they start to self-aggregate. And so you might get 3, 4, 5, 8, 12 A-beta molecules together, self-aggregating into oligomers. And the same happens for tau. Now, it's these aggregated forms of the neurotoxins that most of us now in Alzheimer's research believe cause the disease. Not, I want to indicate strongly, not the insoluble form of A-beta present in neuritic plaques, and not the insoluble form of tau present in neurofibrillary tangles. Now, what does our technology do? TRFT breaks up these toxins, these oligomeric toxins, inside neurons and removes them from the brain. I don't know of any other therapeutic that can do that.
Yeah, I mean, that's fascinating. And of course, we're going to talk a little bit later about how you've progressed clinically on all of this. But of course, having the breakthrough status from FDA is incredibly encouraging for the fact that obviously this is such a huge issue for so many people around the world. And of course, TRFT has this ability to rejuvenate the human immune system as well, right? So could you maybe just explain a bit more about that for us?
Sure. As far as the immune system goes, immune system dysfunction is the universal signature common to most diseases of aging. Any serious longevity intervention field, in my mind, must address this dysfunction, which is basically an imbalanced immune system that occurs during aging. I'm excited about TRFT because we have clinical evidence that TRFT can restore immune balance in both the human body and the brain. And when I talk about imbalance and balance of the immune system, I'm referring to the effectors of the immune system, the cytokines, which are basically, they're in the blood and in the brain. They're in two major categories, pro-inflammatory cytokines and anti-inflammatory cytokines. And these two components, if you will, are in balance. If you want to have a pan balance, they're equally weighed when you're in young adulthood and middle age. However, as you enter older age in your 60s and certainly 70s, the pro-inflammatory pan becomes heavier. There's more pro-inflammatory component than anti-inflammatory, and that causes a chronic state of inflammation, which is the primary cause of major diseases of aging. Now, the important thing to remember here is that centenarians, those who live above 100, never lose their balanced immune system. Going through their 60s, 70s, and 80s, both components are robust and they maintain a low level of inflammation. They have an immune age, Phil, 40 years younger than their chronologic age.
Wow.
So I think that's very important. And to my knowledge, TRFT is the only longevity intervention that can rejuvenate, if you will, the human immune system. And it does so by rebalancing cytokines. If the levels are too low in the blood or the brain, these radiofrequency rays bring it up.
Okay.
If they're too high, they're brought down.
Wow. So I can understand if you're wearing a device that's putting safe radio frequency into the brain. I understand the mechanism broadly of how that might work. But how does that extend into the cytokines across the sort of systemic elements of what you're talking about with the immune system?
Yeah, that's a great question. How, if we're delivering these radio frequency waves to the brain, are we affecting the immune system in the body? The answer to that question is that the brain's blood vessels receive 20% of blood pumped by the heart. We are affecting the blood going through the brain. Specifically, TRFT affects red blood cells going through the brain's blood vessels. Something that not too many people know is that red blood cells actually store cytokines, these effectors of the immune system. They have any given cytokine concentrated 10 times, 20 times, 50 times higher inside the red blood cells than in the plasma. And what TRFT does is it makes these red blood cell membranes more fluid, if you will, for cytokines to go in or out. That is exactly the characteristic that centenarians have in their red blood cells, more fluidity. Therefore, if a cytokine is in low concentration in the plasma, it leaves through this more fluid red blood cell membrane, and just the opposite occurs if the concentrations are too high. So think of the red blood cells as a sponge, if you will, and the result is a rebalancing of cytokines in blood and a dramatic reduction in inflammation. We see 50% reduction in inflammation in the body with this technology.
Well,
so we're in essence, yeah.
I mean, Gary, it sounds fascinating, and of course, this isn't just theory. You've put this through published and peer-reviewed research. So obviously, you've demonstrated with a small number of users the cognitive decline aspects and how you've addressed that. But how are you proving this in your patients, and with the size of the study that you've done, what is the sort of next stage that you're going to be moving to with this?
Absolutely. All roads for a life-extending intervention go through preventing or lessening dementia. Most prominently Alzheimer's disease, but there are other forms, vascular dementia and such. If you're fortunate enough to live to be 85, 1/3 of the people who live to 85 have dementia. So you're going to have to deal with that for any sort of longevity therapeutic. And TRFT has the mechanisms, we believe, that can accomplish that. We've talked a little bit about TRFT disaggregating and removing toxins from the brain. It's also a mitochondrial enhancer to enhance energy production in neurons as we age. And of course, we talked about the immune balancing. But we've done basically two clinical studies that I think speak a lot about the potential of this technology. The first, we had 8 Alzheimer's patients, and were given daily treatment, TRFT, in home by their caregivers for 2 months. At the end of that 2-month period of time, cognitive impairment in these patients was actually inversed or reversed to 1 year earlier. We know this from the ADAS-Cog test, that basically you lose 4 points every year. Mm-hmm. These patients gained 4 points after 2 months. Wow. And in an extension of this study to 2.5 years, with 18 months of treatment during that 2.5 year period, we were able to completely stop Alzheimer's cognitive progression, not slow it down as some of these prominent drugs are purporting to do, which really isn't the case, but to actually stop its cognitive progression, not in one cognitive measure, but in 8, collectively or separately. And the other thing that we see is that all major Alzheimer's markers in both blood and brain are beneficially affected by TRFT in these patients. No other Alzheimer's therapeutic that I'm aware of has shown this comprehensive disease-modifying effect. Now, my final point here is a word of caution. These are small studies. They're not controlled. Each patient was their own control. So we definitely need larger controlled studies in Alzheimer's patients before FDA is going to approve this technology.
Yeah. So the breakthrough status that you've got is like a placeholder for your expanded plans now for studies. And is that really what's next on your roadmap now, Gary? Is it to extend? What sort of patient size would you be looking at for your next clinical study? And I guess, with the benchmarks and the markers that you've been working on, the standardization tests and so forth, what does that look like in this next protocol that you're moving into? And will you be running that, or will that be kind of like an independent study?
Yeah, as far as Alzheimer's, we're talking about separate studies from the longevity ones that I'd like to do. The Alzheimer's studies would be in conjunction with probably the company that I founded, MemorEM Therapeutics. And, we'll sort of leave that to them, but there are separate studies there. I'm talking about longevity and doing studies that would demonstrate that we have a longevity agent here. And I believe that we've been off the screen, if you will, in longevity circles until now, because it is our most recent clinical studies that have really revealed the potential of TRFT for human life extension. And that was just last year.
Right. So if I can just understand, Gary, so from the Alzheimer's perspective, that's got a vehicle to go forward for studies, but your focus is going to be bringing that around to longevity. So how do you intend to clinically show that TRFT can affect human longevity?
Well, through the new enterprise that I initiated just a few months ago in March, RF, Radiofrequency, Longevity. I hope to quickly identify the funds to start the first of 2 interrelated or interlinked clinical trials that should answer the question, can TRFT have a great chance of extending human longevity? And we think we can get that answer in 5 years, not decades. Both trials will involve normal individuals around 65 years of age. That's when folks start getting these diseases of aging. The first is a 5-month study of daily treatment in home, of course, and that will extend on with many more patients to a 5-year study, presuming we get positive data.
Can I just ask you, Gary, what would be your two questions, if I may? The first one would be, what would the N be? What would be your target population for the study? And secondly, if you're looking to demonstrate within that short period human longevity? How will you measure that?
Well, in the 5-month study, we obviously cannot measure whether or not the occurrence of new diseases of aging is being decreased. We're not going to be doing that. But we are going to be measuring important indices of aging. We're going to measure, for example, inflammatory markers to get an inflammatory age, which we believe should be reversed. Biologic age markers we'll be looking at. Cognitive function we think we can improve upon in normal aging people. Physiologic markers of aging, of course, and not least, neurotoxins, those neurotoxins that cause many diseases of aging in the brain. A beta toxin, tau toxin. We'll measure those and hopefully keep them in check. Now, in the 5-year study, we're going to continue looking at all of those measures, but we're also going to start looking at occurrence of new diseases of aging. Do these folks who are 65, 70, are they getting diseases of aging to the extent that we would expect?
Yeah. And presumably, would you baseline that against population, or would you have a placebo in your study design?
It'd be difficult for us to have a placebo that would take 1 hour of placebo treatment a day, even if it were not continuous over 5 years. So I don't think that'll be practical. We're going to have to compare that to the normal population and what we see as far as diseases of aging in them. And I might add, this treatment does not have to be given daily throughout your life as a life extension therapeutic. We found that after you stop treatment, the effects, certainly on cognition and other measures, stay around for weeks, if not months. So I could see periods of treatment, but not continuous treatment.
Okay, that's interesting. And I guess a really dumb question perhaps, but does this have to be when you're walking around and active, or is this something that people could do overnight, for example?
I wouldn't do it overnight because I wouldn't want to compress the emitters. You can, I suppose, but preferably during the day. Yeah. During the day be best. And you could do almost any activity in your home except take a shower, obviously. Yes. But everything else could be done.
Right. And I guess that people are familiar with wearing wearables now, whether it's around their head or on their wrists or whatever it may be. So I guess, Gary, this sounds great. So you're raising funds now to do the 5-month and then the 5-year study. And I guess that's something where there'll be people interested in this from a research perspective as well as a philanthropic perspective. What do you believe are the necessary characteristics, though, really for an intervention to extend human longevity and health span for decades? I mean, what does that look like? Is it going to be a wearable like yours, or is it some form of combination?
It could be a combination, but I frankly believe that such an intervention needs to target many diseases of aging, not just one, and the aging process itself. And we fulfill both of those requirements, as well as being safe. Now, small studies we've had, something may crop up safe-wise, but not so far, and not in terms of large studies that have been done with the same frequency that we have used and are using. What I think we want to avoid during aging is taking multiple drugs over an extended period of time, many years. I think that's impractical, and I think, therefore, as I've mentioned in the website rflongevity.com, I mentioned this statement: the enigma of extending human longevity is best addressed by a single advanced technology that can safely address or target many diseases of aging and the aging process itself. Phil, I believe TRFT is that single advanced technology, and I hope to soon identify the funds for the final clinical work that we need to do over these next 5 years to hopefully show, hey, we've got something that could really work to extend human longevity.
Yeah, great.
And
Well, it's Gary. It's very important work. I mean, the number of people over 60 now in the world is very much growing, and I can see that there'll be a lot of interest in your studies and watching how they report out, and likewise, obviously, best of luck to you and your colleagues in securing the capital that you need to take it to that next step. Very very exciting work.
well, thank you very much, Phil, for the opportunity to explain this new and exciting technology that I suspect most longevity interested people have not heard of. And in fact, my closing comment would be I'm an outsider in longevity research circles. And a new book by Dr. Michael Fossil spoke to me. In that book entitled We Need to Get Comfortable with Being Wrong About Aging, he states, the major breakthroughs in aging are more likely to come from outsiders than from within the current mainstream. He says, seldom does an innovation come from the mainstream because the mainstream's already involved in what they've been doing for a long time. And I could only hope, Phil, that the longevity mainstream researchers will acknowledge and appreciate the potential of TRFT and share some of the excitement that I have for this technology that I think has a real chance and is indeed a front runner in the field.
Well, I mean, Gary, of course, I can't imagine anybody that wouldn't be wishing you the best of success with all of this because, as we all know, the therapeutic pathway is highly regulated, takes a long time. You've got your FDA breakthrough status, which obviously gives you that right to advance. So, yeah, I mean, please keep us updated on your progress. It sounds fascinating, and I hope you manage to close the funds to get it off the blocks.
Well, thank you again, Phil. I appreciate this interview. And I want to congratulate you as well as I've called you the nexus of longevity research and information, you and Longevity.Technology. So congratulations on the work you do.
Oh, thanks, Gary. That's where we're a great team, and we've all got a long way to go. So really appreciate your time today, Gary. Thanks for joining us.
Thank you, Phil.